Hello, and welcome to a virtual overview of the NYU Langone Hospital's Advanced Education in Pediatric Dentistry Rhode Island site located in Providence, Rhode Island. My name is Dr. Logan Wilson, and I'm the Chief Resident for the 2022-2023 academic year for our program here in Rhode Island. I would like to thank you for your interest. Now let's get going. First, we'll touch on leadership. NYU Langone pediatric residency sites across the nation are led by our program director, Dr. Daniel Kane. Dr. Kane is assisted in his administrative capacity by 3 regional senior associate directors, Dr. Adia, Dr. Akuji, Dr. Akalesh, who oversee geographic groupings of training sites in the eastern, central, and western sections of the nation. Locally, each residency training location has an associate director present on site, giving each training location its own local leadership and vibe. Over the course of training, residents interact with its leadership across all of these levels. Our associate director at the Rhode Island site is Dr. Amir Yavari, who is a graduate from our site, who works tirelessly both in and outside of the program to advance dentistry in the Southern New England region. Rhode Island is also uniquely privileged to work with Dr. Kane in a clinical capacity, as Rhode Island is his home base, enabling residents in Rhode Island to interact with and learn from his expertise on a regular basis. Launched in 2003, the Rhode Island training site, located predominantly at St. Joseph's Health Center, was the first satellite site in the NYU Langone Advanced Education in Pediatric Dentistry program and helped to template NYU's continued growth into the national presence that the program holds today. One of the benefits of training with NYU Langone is that we are taught according to a nationally tested curriculum and mission while working in our daily lives with a small and closely knit group of peers. Pictured here, our current second-year class has formed personal and professional bonds which will extend beyond the end of our residency training. An important part of the culture at the Rhode Island site is camaraderie, mentorship, and teamwork between residents regardless of training year. Pictured here, our current first years bring so much positive energy and experience with them to the clinic floor. Listed in order of cumulative time spent at each site, our residents work at several locations across Providence and neighboring towns. St. Joseph's Health Center houses our main clinic, but we also go to Our Lady of Fatima Hospital for OR cases and some first-year rotations, Hasbro Children's Hospitals where we take call, as well as complete a number of our second-year rotations in both inpatient and outpatient environments, and at Providence Community Health Centers, we gain further interprofessional experience working with several teams of specialized providers. Next, we'll talk more in depth about each of these locations. First up, St. Joseph's Health Center. As mentioned, St. Joseph's is where residents work on their chairside dentistry skills. We serve a large and diverse patient population with a high need for dental care across all aspects of clinical dentistry, which pediatric dentists can provide. Due to the immense demand for dental care, Rhode Island residents graduate with a robust clinical experience and are well prepared for job opportunities after residency. On the clinic floor, we are taught by Dr. Kane and Dr. Yavari, as mentioned earlier in the presentation, as well as Dr. Downey and Dr. Tayo, providing a wide scope of experiences from which to learn. Dr. Kiang and Dr. Paquin assist in offsite experiences where residents are exposed to specialized services of pediatric dentistry. All attendings are committed to education and make themselves available both during and after hours for any questions that arise. Patient care starts at 8 a.m. with a daily huddle and finishes at 4:30 p.m. Each resident is assigned their own room. Nitrous oxide and protective stabilization supplies are available when indicated. We run on Dentrix software and use phosphor plates for radiographs in the clinic, but have digital sensors when we are in the OR. Further adding to our faculty expertise is Dr. Aaron Urkel, our oral surgeon. Residents get opportunities to work with Dr. Urkel both in the clinic and in the operating room. In our work with Dr. Urkel, we are exposed to wisdom tooth extractions, canine uncoverings, frenectomies, pathology excisions, and supernumerary teeth extractions. Dr. Urkel also runs an annual suture clinic with residents, providing a valuable refresher for skills we need when seeing patients in the emergency department while on call. On several Mondays throughout the year, residents get the opportunity to work with 2 local and experienced orthodontists, receiving both didactic and clinical exposure to orthodontic management of our patient population's needs. On these so-termed Ortho Mondays, residents learn how to manage both interceptive and definitive cases. It is the goal of our orthodontist attendings that residents graduate feeling competent in how to treat anterior and posterior crossbites, palatal expansions, and open bites. Both through our orthodontist-led clinical interactions and in regular clinic, residents can gain experience in prescribing, delivering, and removing both chairside and lab-ordered unilateral and bilateral fixed space maintenance appliances. Thanks to graduates of the Rhode Island program who have since received further specialty training to offer these services in their own private practices, and because of expert plastic surgeons in the area, one aspect of training that our site has become known for is our exposure to the management of craniofacial abnormalities. We have the opportunity to follow cleft lip and palate patients through the process of nasoalveolar molding, or NAM, during the first months of life, with continuity into initial and subsequent facial reconstruction surgeries. Residents also rotate on Hasbro Children's Hospital's cleft lip and palate / neurodevelopmental team that provides interdisciplinary care to these patients throughout childhood and into adolescence. Following are 2 examples of complex medical histories associated with special healthcare needs, which illustrate the type of medically diverse patients commonly encountered in our patient population. Here's a second example, this one of Stickler syndrome, of which there are an estimated to be fewer than 5,000 cases of in the United States. Our clinical experiences at St. Joseph's are made possible by our devoted administrative staff who treat our patients and the residents like family. Between our dental manager, clinic manager, and education coordinator, there is always a huge amount of effort put in behind the scene. St. Joseph's has a quick-paced and rapidly evolving schedule, which is kept moving by our team of hygienists and dental assistants hailing from diverse backgrounds and experiences. Our patient population speaks many languages. If no staff member speaks the language, the clinic always has access to the language line for interpretive services. Our front desk team is never not working, and they keep the clinical schedules full and confirmed to the greatest extent possible. Our residency is also set up where the front desk takes care of much of the needed paperwork for the appointments, freeing up residents to focus on patient care. Now on to our next training site, Our Lady of Fatima Hospital. Fatima is where we complete our anesthesia rotation during first year and is also the site of all of our general anesthesia and sedation cases. Our residency site has a consistently robust exposure to general anesthesia cases due to 2 big contributing factors. First, we are the only service in the state capable of providing hospital dentistry to patients on public health insurance. And second, as a residency site, We have our own designated operatory suite, which books only our clinics, general anesthesia and oral conscious sedation dental cases. Given the needs of our patient population, paired with training goals of the residents at the Rhode Island site, 5 days per week access to a surgical suite is an undeniably extremely valuable resource. Here is an example of the caries burden present in our patient population. In general anesthesia cases, residents complete comprehensive dentistry, including stainless steel crowns, pulpotomies, strip crowns, prefabricated zirconia crowns, extractions, and space maintenance, all with a heavy emphasis on evidence-based, patient-specific treatment. In our sedation cases at Fatima, residents are exposed to considerations in case selection, medication dosing, behavioral management, and management of emergency situations. As mentioned, we also complete our 20-day anesthesia rotation during our first year at Our Lady of Fatima Hospital. The anesthesia and surgical staff are extremely welcoming, and dental residents are encouraged to be as hands-on as they want as they work next to anesthesiologists, CRNAs, and SRNAs, gaining exposure to skills including intubation, bag mask ventilation, patient monitoring, and starting of IVs, all of which are extremely important skills to possess as residents enter practice after residency. Next, on to discuss Rhode Island children's dentistry and orthodontics. This is the private practice of several of our attendings located about half an hour south of Providence. Residents rotate at Rhode Island Children's Dentistry when following NAM patients and to observe laser dentistry for frenum management. Dr. Kiang and Dr. Paquin, both graduates of our residency, offer lots of knowledge on these highly in-demand treatments. Moving back into Providence for the Rhode Island residency's 4th training site is Hasbro Children's Hospital. Hasbro is a level 1 trauma center and is the only designated children's hospital in the state. Hasbro is where we rotate for our 2nd-year rotations, including hem-onc, sickle cell, refugee clinic, and inpatient rounds. Most notably, Hasbro is where residents take call. Residents are on call for 1 week at a time, on average once per month. When on call, we cover from 4:30 p.m. to 8 a.m. on weekdays, and we provide 24-hour coverage on weekends and holidays. It is the expectation that residents live within 20 minutes of Hasbro, accounting for traffic, to enable timely response to pages. Residents are always paired when on call. During the first 6 months of residency, the 2nd-year resident is on first call, with the 1st-year resident accompanying all pages. Come roughly December 1st, 1st years switch on to first call, and 2nd years switch to 2nd call to assist whenever needed. As Rhode Island Children's Hospital, Hasbro Emergency Department sees a lot of dental trauma. Residents will become extremely adept at managing a wide range of traumas through splinting, extractions, provisional restorations, direct and indirect pulp caps, bracket removals, and suturing, both on awake and sedated patients. It is highly likely that you will encounter a trauma case at Hasbro that will stick in the memory for the rest of your career. This is one example of a commonly encountered type of trauma. This is an example of initial trauma, note the time that the residents were paged, with clinical follow-up photos for comprehensive follow-up post-trauma. This next example illustrates our approach to trauma at Hasbro. Any patient we encounter in the emergency department is always given a referral back to St. Joseph's to enable comprehensive care for anyone seeking it. This is also valuable in giving residents exposure to watching immediate and long-term sequelae of dental traumas. When indicated, residents also receive additional sedation experience at Hasbro, where intranasal midazolam and IV ketamine may be utilized. Oral surgery residents are also present within the hospital, so should a resident encounter a trauma that they feel is beyond their scope, there is no pressure to practice outside of one's ability. Our rotation at the refugee clinic, headed by Dr. Carol Lewis, is another way in which Rhode Island residents help to ensure delivery of dental care to those who need it most. In partnership with Dr. Lewis, residents attend initial primary care visits for refugee families who have recently entered the US. After triaging these patients at this initial encounter, we then refer them back to St. Joseph's Dental Clinic for comprehensive care and to establish a dental home. Another program that 1 to 2 second-year residents are selected to take part in each year is the Ortho Experience, which is a multidisciplinary program that meets weekly and gives participants extra training and exposure to treatment considerations for neurodiverse patients. Our program also incorporates teaching experiences in which we partner with Tufts School of Dental Medicine. In our second year, we complete 4 to 5 days teaching pre-doctoral students on site at the dental school's Boston campus. Per NYU curriculum, here's a breakdown of what our program's requirements are and during which year of training residents are expected to complete each. The beauty of the Rhode Island site is that with how active and engaged our residency site is, these clinical requirements are met and or surpassed with ease. What will your schedule look like at our residency? In first year, the focus is on care for the well child. First year residents are primarily in clinic and the operating room. You can also see periods of time blocked out for anesthesia and emergency department rotations, as well as weekly didactic sessions. In your second year, clinic and OR time is still the consistent backdrop. The second year resident also starts focusing on management and treatment of the sick child, as can be seen by the increased number of rotations. On both years' schedules, you can also see the ortho days interspersed. The didactic curriculum is standard across all NYU sites. In the first year, residents attend weekly virtual lectures presented by faculty and attendings from all 13 sites, providing access to expertise otherwise unreachable without NYU's national presence. First-year residents also complete monthly learning modules to supplement the weekly lectures. Across both years, residents complete weekly literature reviews. NYU's approach to didactics is well proven, and many graduates have been recognized on the national level for academic performance on the American Board of Pediatric Dentistry's qualifying examination for both the Roche Award and the Pew Award. You can see that the Rhode Island site has a strong representation on this list over the years, and one of our current attendings, Dr. Tayo, brings this degree of academic excellence to her instruction and tutelage of Rhode Island residents on the clinic floor. These Rhode Island graduates have been recognized by NYU for their work in craniofacial abnormalities. Continuing this theme, these statistics are the national average for all residency programs. Historically, NYU Langone graduate statistics are greatly above this national average for both initial passing of the qualifying exam and eventual attainment of board-certified diplomate status. Here's a breakdown of benefits residents can expect. Pay is similar across both years, with a slight increase second year and additional stipend for those selected to be chief resident. NYU supports its residents with additional stipends for educational material and NYU reimburses the cost of registering for the qualifying exam. Our benefits package also includes paid time off, CE days, paid official holidays, and a selection of medical and dental insurances from which to choose. Outside of residency, our Rhode Island site has a lot to offer as our sense of community extends beyond the clinic floor. While the pandemic changed what and how we were able to do, many community programs have survived and others await dormant for reactivation when the time is right. One of the biggest community events is the annual Community Christmas Party, where the entire clinic hosts a Christmas gathering for our patient population, giving out thousands of donated gifts. The care, excitement, and coordination that goes into keeping this tradition alive for the benefit of our patients is inspiring, and it is special to take part in the 35-year standing tradition during our 2 years here. Housing options in Providence and surrounding communities are greatly diverse. From managed condos and high-rises, to renovated lofts, to duplex rentals, to full house rentals, each resident has been able to find well-suited housing to their needs. Providence is the capital of Rhode Island and the largest city in the state. With several colleges and universities in the immediate downtown area, there is lots to do, even before looking into surrounding towns. Providence is well known for its food scene, especially its Italian food selection on Federal Hill. During the summer, the whole street is shut off every weekend to allow for street music and outdoor dining. There are also lots of street fairs and pop-up flea and art markets that take place around the city. Another event that Providence is well known for is Water Fire, where the river passing through downtown is lit up with torches floating in the river, while arts and food vendors line the bank. In true small but mighty fashion, there are lots of Rhode Island specific foods and treats to check out on your time here. Example, if you order a plain pizza from a local pizzeria, you will get the crust with red sauce on it and no cheese. I'm not saying it's not still good, but chances are it wouldn't be what you were expecting. May this tip save you some confusion the first time you go to get a quick bite out after a long day of residency training. Since we are only an hour south of Boston, we also have easy access to New England National League teams. Rhode Island has lots of coastal shoreline and beaches. In Newport, in addition to the shopping and beaches there are also historical mansions open for tours and the nationally recognized Cliff Walk. Colt State Park, Block Island, Narragansett, and parks around the state all make day trips outside of Providence a continually engaging year-round exploration. Your co-residents will quickly become the support network needed to navigate the stresses of residency. Residents at the Rhode Island site are able to maintain a good work-life balance. Our teamwork, along with how our training is structured and the web-based didactic learning, all combine to make this possible. Everyone at St. Joseph's loves the opportunity to do a potluck and to get to spend time together as a clinic outside of patient care. Halloween, Thanksgiving, Christmas, baby showers, goodbye parties, and so on, you name it. Chances are we've had a staff gathering for it. Everyone at St. Joseph's works hard to provide for our patients, and these parties are a wonderful way to take a breath and appreciate the team around us. Between childcare, being on call, and coordinating all of our tightly planned schedules, it is undeniably a feat to pull off group gatherings outside of clinic hours. When they happen, though, it is always well worth the effort. Here at Rhode Island, we continually grow as a group, and this shows in our professional and personal dynamic residency class. My hope is that I have painted a picture of a professional, rigorous, highly tested, and diverse training environment here at NYU Langone Advanced Education and Pediatrics Rhode Island site, an approach that is heavy on clinical experience while still allowing for personal life in a setting full of people who care deeply for those around them. With a bit of luck and a lot of hard-earned accolades, you too may be able to experience what our site has to offer. Thank you for your interest, and all of us here in Rhode Island wish you the best of luck in your residency application process.